Good morning, everyone, and welcome to day 2 of the Bristol Poverty Institute conference, Poverty and the Sustainable Development Goals from the Local to the Global. I'm Ollie Watson from Bristol Health Partners Academic Health Science Centre. I'm going to be guiding you through today's session. Thanks very much for joining. It's great to have you all here this morning. I'm really looking forward to learning together today about access to welfare benefits and advice and the relationship with health in Bristol. So at Bristol Health Partners, we know the importance of this issue through the service users that we work with, and we're really grateful to be collaborating with colleagues at the Bristol Poverty Institute to explore this topic in more depth with you today. Now, before I introduce our speakers, I've got a few words of housekeeping. So the session is going to be recorded and posted on the Bristol Poverty Institute YouTube page and also embedded on their website. So by attending, you're consenting to being part of that recording. We'd ask that you ensure that your name is listed on the Zoom call today, rather than being listed as guest. That will really help the BPI team and also help each other to become acquainted. So you can do that by clicking on the box that has your video in, clicking on the 3 dots and then selecting rename if you need to. And perhaps if you wanted to tag in your organization, that would be really helpful too. For those of you that use Twitter, the account to link in is @BristolPoverty. And the conference hashtag today is #BPIConference2021. And in terms of asking questions for our speakers, we're going to be using the Zoom chat function for that, which you can find on the bottom of your Zoom screen. We'd like you to sort of post your questions as they come to you whilst you hear the speakers talking, but we're going to pick up the actual questions in a session later on this morning, and I'll read them out on your behalf. So when you're typing in your questions, it'd be great if you could say who the question is directed to. And due to some of the time constraints we've got this morning, we might not be able to answer every question, but please do feel free to get in touch with the speakers after the session, and you can do that through the BPI mailbox as a starting point. And just a quick note for our speakers this morning, I'm going to pop up when your time is out. I'll be up on the video, so don't be too alarmed when you hear me jumping in. And as a final piece of housekeeping, it's quite an emotive topic that we're going through together today, so please do be respectful. All the events at the conference are being monitored, and colleagues are going to reserve the right to remove anyone who might be making any comments that are deemed offensive or derogatory. But I'm sure we're all going to want to approach today with sensitivity and inclusion in mind. So the plan for today, so we're going to start by learning about some of the issues from our speakers in 4 short talks. We're then going to work together in breakout rooms on some of the challenges and potential solutions to the access issues that we identify. And then we're going to come back, hear the top points from the discussions, interact more with our speakers, post some questions, and then finally summarize some next steps from everything that we've built up together. And I really hope that everyone's going to take away some new insight today, some new connections and things to work on together. So to get things started, we're going to hear from Sarah Davies. So Sarah is the co-lead for the Livelihoods and Debt theme in the Bristol Poverty Institute and a researcher at the Personal Finance Research Centre at the University of Bristol. And Sarah's going to give us a good overview of some of the issues. So over to you, Sarah.
Okay. Right. Okay. So is my screen sharing properly?
We can see your screen, but it's in sort of PowerPoint mode rather than slideshow mode.
Oh, okay. Let's see. Is that
Perfect. Yeah. Thanks, Sarah.
Okay, so the overall purpose of the session today really is to hear from the lived experience from a number of groups in Bristol on the issues of accessing benefits, and these discussion will feed into a wider discussion. But I'm just going to start by very briefly framing the issue of access to benefits within a sort of wider context of how services are accessed. Over the last few years, there's been a sort of increased understanding that not everyone is able to access services with the same ease, whether these are financial services such as banking or getting credit, state-provided service including benefits, or utilities such as gas or electricity. So we've been trying to identify and explore the barriers to access, to understand where they come from and which are most harmful to which groups of people. So while looking at the poverty premium, for example, to try and understand why those on low incomes end up paying more for essential goods and services, we explored in detail what we call demand side factors, so the factors that are driven by the needs of households, supply side factors, which is how providers offer their services, and compounding factors such as geography and digital exclusion, and looked at how these interact to produce the poverty premium. And the idea was to produce a framework that helped us better understand the complex ways in which different factors create barriers that may not be immediately evident. So in terms of finding a framework to understand the barriers to accessing benefits, so today we hope to start identifying some of these factors, both those that could mean helping households do what they can and those that suggest that change is needed in the system. So for example, we may need to consider the channels through which access to benefits are offered, how the rules for eligibility change or impact differently on different situations, and from the household perspective, you know, how accessibility needs vary in terms of ability to physically access places, or increasingly in terms of digital inclusion or capability. And I think this is one of the biggest issues, the digital divide. I mean, it's a factor that's increasingly relevant to accessing any services. Good digital access and capability are needed to claim many benefits. And researchers found that digital access is lower among older people, those on lower incomes, and those with disabilities. And these are all groups that have a higher likelihood of needing to claim benefits. The next session in the conference actually explores the issue of the digital divide in greater depth, so I would definitely recommend staying to hear that discussion. But clearly this is an issue of an area of concern in terms of fair access. I mean, the issues that the online access of universal credit has caused have long been highlighted and undoubtedly exacerbated through lockdown, when there was little access to any face-to-face support. But I think the system overall isn't necessarily designed to support everyone either. Recent and not so recent changes to the benefit system will have have had an impact on who's able to access welfare payments and under which circumstances. Research back in 2011 noted that even before the 2008 crisis, there'd been a move towards welfare to work as an underlying ethos of benefit eligibility, which then makes it harder for those who are unable to increase their income through paid employment. And this is particularly harmful to women, who may be the second earner in the household and could face a bigger earning disregard, or those who are limited by caring responsibilities. At PFRC, we also found this in 2014 when we were exploring work patterns in low-income to adult households, that caring responsibilities and disabilities were the main reason for the supposed underemployment. And yet accessing benefits is actually vital for those who are unable to increase their income through paid work. And the system's made it hard in recent times. It's important because there is a definite relationship between poverty, worse health outcomes, and those in vulnerable circumstances. And in fact, accessing benefits should be a way of helping lift people out of poverty, in theory. There's a strong link between poverty and disability, for example. Almost half of all people in poverty in the UK are living in a disabled household. So ensuring that they're able to access all they're entitled to is vital. And those who need to claim benefits are often in a vulnerable position. The Adult Psychiatric Morbidity Service showed that nearly half of all working age adults receiving an out-of-work benefit have a common mental disorder such as depression or anxiety, and that actually negotiating the benefit system itself can make it worse. The Money and Mental Health Policy Institute conducted a survey and found that over 90% of those in their panel had reported some level of social anxiety while engaging with the benefit system. People reported physical symptoms like a racing heart or sweating, or behavioural changes such as turning to alcohol or just avoiding dealing with the situation. So clearly there is some support or change needed. Difficulty in accessing benefits is not just confined to those with disabilities either. Research from Warwick University in 2010 found that not only were older people from Black and minority ethnic groups more vulnerable to poverty, they were less likely to be claiming the benefits they were entitled to. This might have been through a lack of information on the available support, language barriers, or through the intersectional disadvantage of age and race. One of the conclusions of the paper, though, was that in the involvement of local community groups could help increase the take-up of benefits. So this seems like a really good time to pass over to those who are speaking from this perspective. Hopefully, this has just given an idea of some of the issues around accessing benefits, why we need to improve access. And so on to the next speaker to shed some more light on this.
Wonderful. Thank you, Sarah. That's been a really good overview of the issues. And if you do have questions for Sarah, do pop them into the chat and we'll pick them up as we go along. I'm just going to quickly check if our next speaker has joined yet. And I'm just looking through the list of names. Doesn't look like he's here just yet, but I spoke to him on the phone. I know he's on the way in. So I'm wondering, Andaloris, if you wouldn't mind if we came to you next. So I'm really pleased to introduce Andaloris Chacon, who's the Chief Executive Officer of Bristol Black Carers, where she works to assist, support and empower young and adult carers. So Andaloris, it'd be great to have your talk now. Thank you.
Good morning, everyone. Thank you for inviting me. And I like the introduction of the topic because each one of those areas of research has affected our carers and our communities directly. But one of the things I would add in terms of accessing benefits is our perception in the community about benefits is a handout and you're begging. So that is one of the reasons why our community do not apply for benefits. And we did a program, well, a pilot, with helping our carers, giving them a helping hand with dementia, because dementia is the new buzzword that people need to understand. It is a mental condition as well as physical for the individual. But the major part of it is the impact on the carer. And because the carers tend to focus on their loved ones with dementia, they tend to forget about themselves. And financially, they strain themselves in order to provide everything that their loved one require. So applying for benefits to support or to help them hasn't been the first thing on their minds. Some of them were already on PIP or DLA, but the carers allowance is one of the things that most people never applied for. And they just, what must I say, describe it as, we just got on with things. So that's why people didn't think to ask for help. And we are now raising the awareness among carers that there is help out there in different ways. And during COVID, we had an increased number of people applying for the carers assessment, which is a grant to support the carer to do something for themselves. We also supported other people to challenge and appeal the benefits for their loved ones so that they can have some funds to assist. Some of the other problems is that trust is another issue where people don't tell their stories because they don't trust the organizations that they go to. And because of that, they tend to keep their suffering in silence. So we need to be able to create an environment that is safe in order for people to share their stories, for us to identify what support is out there to help them. And for instance, I will give you a case study with our dementia pilot. We had a 60-plus-year-old man who has his medical and mental conditions caring for years for his mom with dementia. He was unable to clean his house, cook food as he would like to, but it took him quite a while to tell us about this incident. And we decided to help him by providing someone to deep clean his home, and his whole mood changed. He was laughing, he was happy, he was jolly because his environment was the way he would like it to be. So these are things we need to think about in supporting people. It's not just the benefit in terms of financial assistance, but the other things that go with staying well and healthy.
Fantastic, Andaloris. Thank you. You've given some really good insight there into some of the sort of cultural barriers, but also sort of internal barriers for carers in coming forward to ask for help. So thank you. And as we said, if you've got questions for Andaloris, do pop them into the chat and we'll come to those together a little later on. I'm wondering if colleagues from Age UK Bristol would be happy to go next. And you've got a nice comment there from Peter in the chat, and Dolores, saying how helpful that was. So I'm wondering if Kay and Ben are ready to go next. That would be fantastic. I think it follows on very nicely. So I'm really pleased to introduce two colleagues from Age UK Bristol. So Kay Libby, who's the Chief Executive Officer at Age UK Bristol, and Kay's working to not only provide practical support to older people, but also help to build an age-friendly city, which is great. And we've also really pleased to have with us Ben Sansom, who is Advice and Support Manager at Age UK Bristol, where Ben oversees the provision of information and advice on a wide range of issues, which includes benefits and allowances, council tax, priority debts, and much more, which I'm sure we'll hear about shortly. And I think, Kay, you're going to start, so over to you. Thanks very much.
Thank you. Ben is just loading the presentation. So I'll wait for him to start.
Is that showing up for people?
Yep, that's great, Ben. I can see. Thank you.
Thank you, Ben. Lovely. So if we just move on, because I think we've introduced ourselves. If you could move to the next slide, Ben, please. I'd like to talk about the work that Age UK Bristol has done with other organisations since the start of the pandemic in March last year. We found that so many older people were struggling. You know, if we pitch ourselves back to that point, it's easy to forget, but at that time, older people were required to shield in their own homes. They were running out of food, they were running out of money. Older people who were less likely to use online banking, who were digitally excluded, were at home without the ability to buy or provide and source the basics. As a result of that, 8 organisations got together to look at what we could do to make things easier, so that, quite frankly, no door was the wrong door in a time of crisis. People didn't have to think about who they contact to source food, who they contacted if they worried about picking up a prescription collection. And those 8 organisations have now grown over the last year. There are now 38 of us working collaboratively, and Dolores also is a support hub member. And we are working together to provide a very wide range of practical, social and emotional support to older people. So between us, we realised that we could cover off quite a lot of people's needs. And we found it beneficial working this way, so we continue to meet monthly. And we're looking at the future because it feels that this is the right way for us to work, and it's actually more beneficial for older people. We now receive over 100 calls a week to the helpline that feeds referrals on to other support hub members. Age UK Bristol is still running the helpline. We have a triage function to ensure that there are appropriate referrals onto our hub partners. The majority of calls, however, are still for Age UK Bristol's information and advice service. Ben, if you could move us on to the next slide, please. Just wanted to show you with this pie chart the sort of cumulative impact of referrals through to us over the last year, and the 39% in the bottom right-hand corner are referrals for information and advice. So by far and away, most of the calls through to the helpline, very much for people who are in debt, seeking help with applying for benefits, and who have a variety of financial problems and worries. I'm going to hand over to Ben at this point to sort of dig in a bit deeper and to look at our information and advice service, the sort of calls that come through and the impacts on people's health. Thank you, Ben.
So as an advice service aimed at people aged 55 and over, obviously income maximisation is a key part of our work. And I thought I would check, and over the last decade it has grown. Benefits advice has grown from 35% of our annual queries in 2011 to nearly 60% of our queries last year. The impact of the last decade has been particularly harsh on disabled people and people at the lower income deciles. We regularly get reports from clients that they physically dread the brown DWP envelopes falling through the letterbox. And we see our role as being a stable and safe space for people to ask the questions about what they're entitled to and to know that they are getting accurate information. One of the key problems over the last decade has been the DWP stepping back from an information giving role, and there have been tribunal decisions that have confirmed that claimants cannot rely on DWP call handlers to give them accurate information about their entitlements. So we see that as a key part of our role. So we offer benefit checks to every client that approaches us. Even if they contact us about something else, we will drop it into the conversation somewhere along the line. And then we will go through a process of looking at disability benefits, means testing contribution-based benefits. And then we look at all of the extra bits that go around that. So things like reduced water bill tariffs and the warm homes discount for people's gas bills. We do see financial information and advice as wider than just income maximisation, though. Lots of the people that come to us actually need help to manage their affairs and to manage those finances, as well as just to deal with the poverty that they're experiencing. So we give a lot of advice around lasting power of attorney, third-party mandates, becoming an appointee for the DWP, so you can manage somebody else's affairs, things like that. That generates a lot of safeguarding work, because obviously as we become involved in somebody's personal circumstances, we learn about their vulnerabilities and often have to help them become safer than they were before they approached us. And finally, we also see helping people to plan and prepare for social care as part of the financial information and advice that we should be delivering. And that isn't helping people to avoid liabilities. We very, very rarely get contacted by someone with assets that's trying to avoid paying social care. We tend to be contacted by people who've lived with physical or mental health issues for decades, are on very low incomes, have very few assets, and simply do not understand how they are going to pay for the social care that they need to remain safe and well in their own home. So what are the key barriers? A lot of the barriers existed before the pandemic. So the pandemic has made things worse, which I will come on to in a minute. But before that, the key barrier really is system complexity and people not knowing what they don't know about the system. The basic welfare rights handbook that we use to advise our clients is 1,890 pages of 8-point type, tiny type. And that's the basic advice giving handbook that we use. There are more complex ones that are held by Age UK National that we ask them to refer to on our behalf. The idea that a member of the public would be able to understand those hundreds of thousands of words to try and unlock their entitlements is just a ridiculous proposition. And it is important to understand what a mistake means when somebody is applying for benefits or making a mistake when applying for benefits. For many of our clients, it means literal utter destitution, no income at all, no means to pay for food, heat, transport, anything at all. Again, that's what gives rise to the fear that many of our clients have of opening those brown envelopes. And for many of them, they will arrange for us to be on the phone with them at the same time whilst they open it so that we can talk them through it. The unknown unknowns are where people just don't understand what exists. We understand that the benefit system is difficult. That's generally understood. People just think there is no support there. And politicians seem to have given up on encouraging people to apply. I can't remember the last time I heard anybody suggest that someone might want to claim council tax benefit, for instance, which still exists and is still available to many of our clients. As was mentioned by the previous speakers, digital by default is very difficult for our client cohort. We've done huge amounts of work over the years trying to train people how to use digital devices, but there's a fundamental difference between being able to log into Facebook and send your niece a message and being able to manage a complex benefit claim where your capital, your hours of work, the income of your partner, how many children you have, their exact disabilities may all impact on the entitlements that you have. They're very different things, and I think politicians treat anybody who has a digital device as somebody who is able to access digital services, and that's just not the case. Alongside that, over the last decade, physical access to support and to means of claiming benefits was massively reduced. Housing offices, job centres, all of those kind of physical locations were closed. And there may have been good economic arguments for those in each locality, but we can't pretend that that hasn't disadvantaged huge numbers of disabled and older people. And finally, as was touched on by Andy Loris from Bristol Black Carers, there is still huge stigma about claiming benefits. Within the last decade, the largest selling newspaper in the country ran a front page story about someone who had murdered 6 of his own children under the headline "Vile Product of Welfare UK," placing the blame for his crimes at the feet of the welfare state. And that kind of media coverage sticks in people's minds. They may not consciously think about it, but it's just there lurking in the background. So as well as the personal stigma of not wanting to be seen to be begging or asking for something, there is that society stigma where people still want to avoid claiming benefits if they can. We saw the evidence of this last year when across the country about 500,000 people who could have claimed universal credit didn't claim it. And we see it every day where we try to persuade our clients who are living below the poverty line that they really do deserve to be able to eat and heat their home at the same time. The pandemic did make delivery much more difficult. We chose to shut our advice service to the public 2 weeks before the national lockdown was implemented. We just felt it was unfair and unsafe to expect our volunteers to carry on coming in to a small enclosed interview rooms to sit with people for hours on end. That meant an immediate move from mixed delivery, where approximately 60% of our client contact was face-to-face, either in the office, in outreaches, or through home visits. We're moving to a model where for the last year, around 80% of our client contact has been over the phone. This hasn't been easy, but we have a very experienced paid staff team, very small, but experienced paid staff team, and a volunteer team who have lots of whom have been with us for a long time. So it was the digital process that we had to work with them on, not the actual mechanics of the advice they were delivering. We retained about half of our volunteers, around 9 or 10. The ones that were unable to continue were either because of digital issues, caring responsibilities, or their own ill health. One of the things we learned very quickly was that delivering advice over the telephone literally takes twice as long. Establishing the facts, trying to help clients understand what the letters they're reading out to us actually mean, waiting for people to find the right bank statement in amongst a pile of 200 bank statements, the kind of things that face-to-face we would have done in a few moments whilst talking to somebody, we're waiting for the client to do themselves at the other end of the phone, and that means everything takes a lot longer. And the relationship building is the key aspect that suffers through telephone work. Advice work is a process that's based on empathy, and empathy is much easier to express in person. When you're listening to somebody talk, all of your physical signals, the way that you listen, the small noises that you make, all of that helps to build trust with a client. Just holding eye contact with somebody whilst they cry and tell you the most distressing stories of their life helps to build that relationship. And over the phone, it's proving very difficult to build that same trusting relationship with the clients with the most significant mental health issues or the most difficult cases. The other thing that we've realised around advice access is that under normal circumstances, we would do community talks. So we would go to groups and give talks to large numbers of people at the same time. But even more important than that, good information spreads by word of mouth. So what we would often find is that we would see a client who lived on a particular street and we would get them attendance allowance, etc., etc. And then all of a sudden we would have a domino effect of the rest of the street contacting us for advice. Am I wrapping up, Ollie?
If that's okay, that'd be great. Thank you, Ben.
Okay,
Yeah.
so I'll skip through so Kay can do her final slide, if that's okay.
Lovely, thank you.
So there you go, Kay.
Thanks very much. I won't go through all of these, but we just wanted to highlight some of the research from the Marmot Review in 2010 right the way through to the present day. The Age UK research, national research, we'll just highlight that because it's particularly relevant and people may not know about that. But 10 years ago, Age UK National did some research in Birmingham looking at advice services that were embedded in GP surgeries. And they looked at what people spent the additional income on that those advice services secured for them. And 40% spent more on food, 46% spent more on heating, 56% paid for practical help. So very, very much practical things. And people reported that in return for that, they felt greater levels of independence, dignity and participation, all things that we know impact on people's health and well-being. And then very finally, final slide from us, and thank you for bearing with us. This is just so that you can see the benefits and the issues we face. So that service Ben has outlined is 3 paid staff, up to 15 volunteers at any one time, costs £120,000 to deliver a year, and we fundraise for that because we receive no income in order to do it. That service brought in £2.5 million of additional income to older people in the city in a good year. So I think this last year with the pandemic, that reduced to 2 million because of the issues that Ben has explained. In a normal year, we'd bring in 2.5 million. And we feel that we're really pleased to be here today because this holistic look at poverty and linking it with ill health is exactly what we think is needed. There is no holistic funder who is looking across sectors and organisations like this, and we feel it's very much what is needed. So we welcome the spotlight that you're putting on it. Thank you.
Brilliant. Thank you very much both. I think you did a great job there of sort of outlining some of the big macro issues, but also that sort of personal one-to-one things that you can do to help build trust and help sort of navigate this very complex system. And certainly that statistic about the jump from 35%, I think, of your inquiries 10 years ago to 60% now is quite telling, isn't it? Thank you both. That's great. I think now we're going to move to our next speaker. So Mohammed Sayale from the Bristol Somali Youth Voice Forum is here, I believe. Mohammed?
Yes.
Hi, great. Thank you very much.
Hi,
so you're going to talk about some of the work that you've been doing, which we're really looking forward to. Is the slide sharing working okay for you?
It's not working. Can you share?
Okay. Yep, I believe my colleague Sarah should be able to do that just now.
Yeah, no problem. I'll just start it now.
Great, thank you. Thanks. Over to you, Mohammed. Thank you.
Yeah, thank you. My name is Mohammed Sayale of Bristol Somali Voice. We base it on Eastern, and we support young people. We support the young people and their families. Can you move to next, please? And accessing to the benefit during pandemics. Normally, first I have to say we don't precisely work, supporting the young people and family about the benefit. We support the young people on other issues, but benefit is one of the social problems that we support about the young people. And recently we did, report about the impact of the COVID-19 in Somali community, and I take this opportunity to share with you, my understanding and also some of the findings of our report. How the difficulties and the challenge that the community face, to access to the benefits and the welfare support during pandemics. I have to say we support community with a different issue, including work, employment inequity, financial difficulties, money management, bill inequities. That is what they come for our office. Can you move to next, please? Somali community is the largest ethnic minority community in Bristol, and they are one of the largest groups who hit hard by the pandemics as well. The survey and the case study that we conducted between June and August last year has indicated COVID has impacted their financial and household income. Majority of the Somalis, they live, in the inner city ward, like a Barton Hill, Eastern, and St. Paul's, and also Southmead. And one thing in common is these are the most deprived areas in the city where the unemployment, poverty, different forms of the inequality, under services are issued. The target group, which is Somalis, are large family comparing to their white counterparts. The low-income family already, affected by the benefit curve. A majority of them, they don't know where or how to seek support, especially on the benefit inequities like unveiling wrong decisions. COVID crisis and access into the welfare benefit. You all know, or you will agree with me, the COVID has caused a hardship and challenge to our community, but that was disproportionately difficult for disadvantaged community groups from deprived areas, including ethnic minority communities. And association between the ethnicity and the outcome of the COVID, has raising concerns and caused a lot of people to lose their job or not to go to the job. And the COVID hit hard on the areas with the largest BME London and Midlands. And Somalis, they are one of the community who live, the most deprived areas, an area affected by the COVID disproportionately. Can you move to next, please? For example, in the area that the Somali community live in Bristol, unemployment, poverty, poor housing, like overcrowded or unsuitable accommodation were among the issues affecting by the community. 40% of the young people, including Somalis, from BME background, including Somalis, who live, places like Lorsil, were underemployed or, unemployed. And the number of the young people who complete degree or master and work in low-paid jobs, like a taxi, warehouse, security, or maybe working on the NHS, like a porter or cleaner, are proportionally high. Both systematic and structural factors, including lack of effective inclusion and diversity policy, racial discrimination, and others are among the root cause. Can you move to next, please? The benefit that we support the people. If I give you, concise picture in our caseload and the research that we did in August last year has highlighted that the community has not accessed available support during pandemics for different reasons. Our caseload show the benefit that we support about the people are very basic, like a child benefit, child tax credit, housing benefit, universal credit, or discretionary grant support. But 40% of the young people from deprived areas like Barton Hill are unemployed. A majority of them, they do in low-paid, insecure job, which is 0-hour contract. And a lot of young people in the area, they lost their job during pandemics, and they don't know where or how to seek support. And also there is a stigma, relating to applying benefits, and maybe some negative experience. And pre-perception and mistrust is also one of the issues that are affecting the community. Somalis are among the community who are disproportionately affected by the other issue triggered by the COVID. Majority of the young people are doing low-paid job, low-paid insecure job, which are public facing. A lot of young people, they lost their job, during pandemics and face, financially suffered. Majority of the Somalis has not proportionally accessing support available for the community like grants. For example, a lot of young people from Somali heritage, they work taxi, they dominate taxi industry, small businesses in Eastern and also in Lorsil, and, NHS, and they work in different roles also in the NHS, including, health professional and also, working as a cleaner or porters and different, and different in different roles. A lot of people, they haven't got information on, lack of information, poor knowledge on the benefit system, trust, technical problems, were among the issue that, that prevents the community to access, to the support that they're entitled to. A lot of them also, they got stigma, and they got pre-perception, or they got also negative experience. And, they were quite hesitant to apply. I have seen, in our case, we have seen, businessmen who who struggling, during pandemics, and also had COVID by himself, and he hasn't applied any grant, and also he hasn't applied even test and trace, payment support scheme, which is just £500. I want to ask you why you don't apply. You entitled to, you entitled support. And there is a lot of business, a lot of business in the area they apply. He showed me that he is not confident that he will go, or maybe he haven't go. He also showed he's hesitant about that he go, understanding about the system or what he needs to apply or where to start. And lack of support is also one of the challenges that he faces. Can you go to next, please? Can you go to the next page? And in our case, let's show communities struggle to apply test and trace support scheme from Bristol City Council, grants for businesses, and also universal credit. There is, in our case study, there was a young man who shared with us, he'd been working with 0-hour contract, and he lost his job. He was working and he had the virus. Then he has been isolated for 2 weeks, and he can't apply. He don't know where to start. He's not getting any income because he was 0-hour contract, and he haven't got right. And then when he apply, a test and trace support scheme, he haven't got anything. 2-3 months later, he come back to me and he shared with me that he haven't got anything. And that is one of the challenges that the people face. For example, taxi industry, which are dominated by the BME, including Somalis, it was one of the businesses that has been hit hard by the COVID. But a lot of taxi drivers who reach us confirm they didn't apply, the grants because they don't know where or how to seek that support. A lot of young people who doing low-paid precarious job, which is 0-hour contract, which means they should work long hours to earn money because of the insecurity of their work. Some of these young people, when they got the virus and being in isolation, they haven't got any support. And also, I have to mention, the largest Somali community live in Lorosil, especially in the high-rise flats. And, coming from large family background, and 3 people, they go out and do low-paid insecure job. They were public facing, and there was, a chance that one of them may catch a virus and bring back that virus to their home. And also there was insecurity, of their income, and there was no support available for them. And COVID, it makes things more difficult. Can you go to the next, please? In our caseload and the survey, and the cases that they confirmed, pandemic has caused a significant job loss to Somali community. A lot of businesses are closed in Cemetery Road, in Eastern, and also, Lorosil and Church Road. And the number of the community members lost their job and income. And in the survey and the case study that we conducted between June and August last year, 56.4%, they said the lockdown has affected their employment status or household income and financial situations in general. And on the top of that, a lot of young people in the area were unemployed. Can you go on the next one, please? And there is a correlation between losing your job and being, low-paid income. Unfortunately, the COVID crisis, there is a strong correlation between the livelihood of worker being very low with life and those who previously been on the low income. According to research by the London School of Economics, increased earning to the job. The negative impact of the well-being experienced by the whole community is a 4 times effect on the individual alone. And also I have to mention, unemployment and the lack of accessibility of, welfare support, it also affects, the social and the mental well-being of the community. When someone, living with a large family and he is living overcrowded or unsuitable accommodations, and he's doing low-paid insecure job, and at the same time, maybe he lost one extended family member or friend with the COVID, and on the top of that, he is unemployed and he don't know where to start or how to seek support. It was quite challenging. The only thing that we've seen, and people are familiar with, child benefit, child tax credit, which is very basic, and and a lot of people, they know it is it is more simple, than start new application. Can you go on this one, please? Other challenge triggered by the COVID is the issue triggered by the COVID crisis has caused a lot of families to break down. Overcrowded unsuitable accommodations, people who've been, been in long, waiting lists for many years, poverty, unemployment, loss of income, and the lack of appropriate support has caused hardship and arguments for many families, which resulted many families to break down. This was one of the findings, of our report in last year. Can you go on the next one? The lack of diversity and inclusion policy in certain public offices are issue and affecting to the people. Applying benefit is a challenge, and sometimes it's quite humiliating as well. A lot of people, there is a stigma, and a lot of people, young people and families, they don't seek support because of the hesitations, mistrust, lack of culturally responsive support, and some of them, they feel they're being embarrassed in the process. There are not enough Somaliland organizations commissioned by the local authority to offer culturally appropriate support, especially supporting the community about the benefit and the employment. And there are underrepresentations of the ethnic minority community, including Somalis, in certain public offices, whether that is, Housing Benefit Department for Bristol City Council or, other institutions. But one thing that we notice is because we don't precisely work about the benefit, but we support the community on the different issue, and the benefit it come, one of it. But we notice this challenge and the hardship because of the research and the survey and the case study that we conducted, last year about impacting of the COVID-19 on Somali community. That report is available to share. It is highlighting how lack of accessibility lack of accessibility of welfare support are affecting to the mental well-being of the community. And I have to admit and say, I have to highlight, the mental health is a big issue, and it is one of the main findings. It is one of the findings of our report and challenge of the community at this difficult time. Thank you.
Thank you, Mohammed. That's been a really, really good talk. And you've sort of drawn out some of the themes that we've had about stigma and trust and illustrated with the real challenges that real people have been having. So that's been really usefully explained. Thank you. And the report, we can perhaps share a link to it a little bit later because it's a really useful piece of work that we'll share. Thank you.
Thank you.
Colleagues, it'd be great to have some questions for our speakers a bit later. You can post those in the chat and we'll come to them after we've had our time in the breakout rooms. So that's what we're going on to now, so a chance to speak together. We're going to break into two different groups, which are going to be facilitated by people in the team. We're going to go through a couple of different questions. So we're going to talk firstly about, building on what we've heard from the speakers, what are some of the other barriers to accessing welfare benefits and advice, so trying to gather some thoughts on that. We're then going to talk a bit about some of the upcoming changes to both the economy, to services, and the broader society that might be affecting these access issues. And then we're going to really focus on some of the solutions and things that we can do in terms of sort of priority areas for making changes. So those are our three topics. It's going to be that moment of breakout room magic now, I think, where we're going to split into two different groups and your facilitator will guide you through the discussion. So thanks very much to all the speakers so far and look forward to your discussions now. Welcome back, colleagues. It's that strange moment when you're halfway through making a brilliant point and then zap, you're gone. But it's great to have everyone back together and really nice to meet a few more of you on the call. So thank you for your contributions. What we're going to do now is hear just a couple of the points from the other room, the room that you weren't in. So I think we're going to start with Sarah and then I'll come to Sebnam with just the sort of top couple of points that came out in your discussion. So Sarah, over to you for that.
It's okay. Rachel, actually, as a note taker, would you be able to just summarise the key points? Is that okay?
Yes, I can try and do that. So the first point that was made that common across the three presentations were two themes that came up: trust and stigma. And that went on to a discussion around how community-based organisations that are providing support, advice and services are better placed. And the fact that trust and stigma came up means that there's obviously work to be done with those community organisations to ensure that that is eradicated or eased or minimised in some way so that people can access advice, guidance, benefits, etc. We had really, I've made lots of notes, so it's very difficult to pick out 3 key points, but one thing we ended on was around the links to health. So the fact that up until now, the drivers have been about kind of, the ideological drivers perhaps have been about reducing the amount of benefits that people have. And that there's now, for the first time in the NHS long-term plan, it specifically mentions well-being. So perhaps if there can be an emphasis of that systematic view, that the economic drivers are there, because it's very linked to people's, very much linked to people's well-being and their health overall. Just one last point that came up was the recent identification that the pandemic has most hardest hit those under 25 and those over 50 disproportionately. If anyone else from the groups want to add one last point.
I think just to kind of confirm what you said, I think we've just at the last point we were making, it is about understanding that benefits should be part of a whole range of well-being of people, basically, and that they aren't fundamentally the way they are run, the way they are delivered, and the way they're talked about. Has made them almost impossible to be a force for good at the moment, as the way they are, the way they should be. So I think, unfortunately, rather than coming up with sort of practical solutions, it really needs a fundamental rethink of how benefits are placed within people's well-being.
Brilliant. Really, really helpful. Thank you both for that feedback. That's great. Subnam, are you happy to cover what was discussed in our group? Oh, I think you might be on mute, sorry.
I'm happy to make a start, and if you could fill in any gaps that I left, that would be great. I think our talk highlighted the distinction between actual bureaucracy and perceived bureaucracy. There were actual bureaucratic complexities that was evident, especially in access to means-tested benefits, but also participants separated that from perceived bureaucracy, saying how people psychologically feel disabled to bring themselves to apply for benefits. So that distinction came quite strongly. And we also talked about, language barriers and lack of information about what people are entitled to, etc. But we also had the opportunity to expand a little bit upon the trust dimension. Stigma was talked about, but trust. So there is this embedded mistrust in the system as a whole, but also mistrust in the street level bureaucrats and the caseworkers. They don't, especially people from ethnic minority backgrounds, don't think that their cases are being treated neutrally, objectively. So they don't trust that system. And we also talked about particular groups being affected. Disabled children came out quite strongly, young people came out, self-employed, and who else was that? Self-employed people and business, people involved in small businesses, and how they are disadvantaged by the system, and how some of the temporary arrangement made during, for example, the pandemic, like grant schemes, help them out throughout these difficult times. Yes, Oliver.
Yeah, that's a great account of a really wide-ranging discussion, Sebnem. I think, and as on that last point, there was a bit of a sort of concern, wasn't there, that as we're coming now into a phase where a lot of that discretionary support, things that have been set up during the pandemic, are starting to be removed, about how the system kind of works to, respond to that new need, really.
And there were proposals for continued cash transfers and continued support for grants for small businesses.
Absolutely. Yeah, brilliant. Really, really helpful. Thank you. So now at this point, I think we're going to do a bit of questions for some of our speakers. So we've not had people typing in the chat, but I think we'll go a bit more freehand and ask people to raise hands if they have any questions that they wanted to ask the speakers. I've got a few in the back pocket, if not. Okay, it looks like everyone is all right for questions at the moment. So I suppose my first question that I'd be really interested in hearing some views from the speakers on is what we think the biggest difference we could make to helping people access advice would be. What would be the one thing that you'd really like to see change to try and make things a bit easier for people? So I think if we could start with Anne-Dolores, I'll then come to Kay and or Ben. So Anne-Dolores, do you have any sort of initial ideas of things that you think would make a big difference to helping people to access advice?
Well, one of the things would be to decentralize where information is shared and use our community organizations. Because yes, we talked about language barrier, but we're thinking of language as a different, another language. But language barrier also applies to how people say things. And again, English, people think everybody understands English, but that is not the case, because within the Caribbean culture, the way we may describe something is not the way a British person would describe it. So language barrier also means translating English for those people. And if you go to an organization that understands you, then they can break it down in order for you to give the information that is required.
Really helpful. Thank you, Anne-Dolores. Good point there. So Kay or Ben, would you like to come in with your magic one thing that you'd like to see changed if you could?
So Ben, have you got any practical magic wands? Or I've got something that's a bit kind of is up here, but Ben's probably something much.
I think, to be honest, I think to kind of echo what Dolores said really is for organisations to not underestimate the power of very small amounts of funding that is well directed. So a single advice worker who might cost, 20 or 30,000 pounds a year plus on, in total, including on costs and expenses, can deliver advice in 4 or 5 locations across the city, see 3 or 4 people each day, have a huge impact. And that matches what Dolores is saying about bringing things right down to the local level. And by doing that, you can build trust within a community. And one of the things that I didn't stress enough when I was talking earlier is that domino effect within a community. All you really need is 1 or 2 really strong matriarchs or patriarchs in a street or a housing development to say, I went here, I got this good service, and that dominoes through the rest of that community. But what you need is the funding to provide that service in the first place. And I think that's where everybody is struggling. One of the things I didn't cover was that within the last decade, Bristol lost £500,000 a year of funding for welfare rights advice through the cuts to legal aid, when most of welfare rights was taken out of scope. And we're never going to replace that nationally. So it's about local organisations realising that 2 or 3 small organisations can club together, fund an advice worker for a locality, and don't underestimate the impact of that tiny amount of money.
Great, that's really helpful. And it looks like Anne-Dolores is nodding in agreement, which is great. Kay, did you want to have your big picture? That'd be great to hear. Yeah,
good. I think we're really lucky in Bristol to have the one city plan and city office, and that gives us the opportunity to bring together, if we all engage with it and if we use it, it gives us the opportunity to make links across things like health, housing, transport, digital connectivity, poverty, the environment. And that's the place that we should have this discussion, because actually there is such a severe lack of funding. There is huge bottomless demand. And as well as targeting the funding into the right places, obviously I'm going to say groups like ours and Anne-Dolores group, but actually in addition to that, we need the conversation that means it's not just the usual suspects, the usual people looking at poverty and how to address it. Actually, it has to be seen as everybody's issue. And we need to with those, I think we've got 8 thematic boards working to the one city plan now. I think they should each have a target that focuses on this in some way.
Really helpful point. Thank you, Kay. Yeah. And Mohammed, do you have something you'd like to add on that? What would be the big thing from your perspective that would help? think you're muted at the moment, sorry.
I would like to emphasize, if community organization is support the people, I think they will deliver culturally appropriate support for all community, and also in order to ensure that the system work for all the community, it is also important to change and also improve diversity of the staff who working for the community. And that will be important to deliver, culturally appropriate support, and also for the benefit, because, applying benefit is linked with low income, unemployment, poverty, also, it got correlation also in certain demographic areas. So in order to respond all that challenge, there should be systematic change, and there should be improvement in diversity, and also maybe giving some resource for community organizations like us to support the people, on the short term and also on the long term, and also designing target support for specific people, like what happened during pandemics, will be important to make sure community, they go through this difficult time together.
Brilliant, thank you. That's really helpful. Lots of nodding heads there, Mohammed. That's great. So I'm going to give our participants one more chance to ask your questions if you have them. So if you wanted to ask something, just switch your video on and raise a hand, and I will come to you. Looks like we have got a raised hand for Lisa Waddell. So Lisa, would you like to go ahead and ask your question?
Hi there. I just wanted to quickly ask about public opinion in regards to changing some of these policies during the COVID-19 pandemic, and if, there was a conference that JRF did recently where they were talking about how, because more of the British population was in financially insecure, you actually see rising rates of support for welfare policy that hasn't been seen previously. I was just wondering if this group of academics also sees that, or sees that as an uphill battle.
Are there any colleagues who feel qualified to respond on that question? I'm just having a look. Sarah, I'm just wondering if there was anything from things you've looked at.
I wouldn't necessarily, I'm qualified to comment, but I'm happy to anyway. Yeah, I do think that there, and I think the sort of attitudinal surveys that are done, panel surveys, suggest that this is changing. I mean, I think the fact that they had to up the universal credit by £20 was a very tacit acknowledgement that universal credit is not sustainable at the rate it already was. And I think that argument has been played out in the media must make it very clear to people that people living on universal credit are not living some life of luxury on benefits, that they will probably be barely surviving. And I think the reality of having to claim support, be that furlough, be that the self-employed system, has made, again, raised awareness that claiming things in and of itself can be quite complicated and difficult, and there's a lack of information, and a lot of the issues that we've discussed today about claiming benefits goes for everything, really. So I think if ever there were a time to really push for large-scale systemic change of how benefits are doing, I think there probably would be more support for it than there has been for a long time.
Wonderful. Thank you, Sarah. That's a nice, optimistic and sort of powerful note to end on. I think that's been a really helpful question. Thank you. So thank you, everyone. That's been a really, really good session. I think we've heard a lot of really different perspectives. We've shared some of the challenges, but also started to get into some of the solutions, which is really good to hear. I'm just going to talk very briefly about what next. So Bristol Health Partners are going to be working with Bristol City Council a bit about exploring different things that we could do in terms of support for people locally. So that's through a Changing Futures bid. So we'll be working to feed in the discussions today into that work, and we'll come back to this group with more about it. We're also going to be working with a group called the Economics Observatory. So they bring together some of the leading economists around the country to sort of answer challenging questions. So we're going to work with them on this topic to see what the economic evidence can help us with. And really importantly, we're going to continue this collaboration with the livelihoods and debt clusters. So we're going to keep this mix going on like we've had today, the sort of academic, the lived experience, professional voices. And I know Sarah and Sebnam, who lead the cluster, are really keen for people to get involved. So do get in touch to the Bristol Poverty Institute mailing box to do that. And now it's the time for thank yous, because I think we've had some really wonderful speakers who've really engaged kind of creatively and thoughtfully with this topic and given us some really good insight, which I really appreciate. So thank you, everyone. We'd be clapping if we could. Well, I can clap, can't I? It'll sound a bit quiet, but there we are. And the virtual hands are going up, which is great. And thank you very much. The Bristol Poverty Institute team, they've done a great job arranging these sessions, and my colleague Sabrina Lee at Bristol Health Partners as well has done a great job working with all the speakers. So thanks very much to them. A lot goes into these sessions, so thank you for all your hard work. Thanks to everyone who's been here, and you've really engaged very well with it. So thank you, appreciate that. Got a few more housekeeping things to say at the end, which is just that we've got a quick reminder that we've recorded this event. So that's going to be available on the Bristol Poverty Institute website. So you can watch it back and share the link with people who you think might be interested. And you can also catch up with the other sessions that are taking part as part of the Bristol Poverty Institute conference. There's also a book offer. So as part of the conference, I think Bristol University Press have created a virtual space where you can connect up with the people they would have brought normally to a physical event. And they're offering you 50% off a selection of their latest books, as well as free content from the Journal of Poverty and Social Justice. And I think you can find out more about that on the 4 Waves event website at the bottom of the schedule tab. So thank you very much, everyone. It's been great to have you here, great to learn with you. Coming up later is a really good, useful discussion, as Sarah mentioned, about closing the digital divide, opportunities and challenges. So stick around for that. The conference program's got details and links for today and for the rest of the events. So thanks very much, everyone. Enjoy the rest of the conference, and yeah, we'll be in touch soon. Take care.